next door to the cemetery, the Fort Douglas Cemetery, and we are at the Huntsman Mental Health Institute that's associated with the University of Utah. So this institute just got a big project underway. There's a major expansion that was announced in 2021. It's a $150 million project, $90 million from the Utah legislature and for inpatient treatment, and then the rest of it is going to be filled in by philanthropy, including the Huntsman family. Now, the Huntsman family, John Huntsman, they have connections to Philadelphia. Both went to the University of Pennsylvania, so they have ties. In fact, the Wharton Business School's primary building is called the Huntsman Building. John Huntsman was the governor of Utah from 2005 to 2009. But he also has a very interesting background as an ambassador, because he served as ambassador to Singapore under George Herbert Walker Bush's administration. And then he served as ambassador to China under Obama. And then he served as ambassador to Russia under Trump. So he's been doing a lot of outreach, shall we say, and then he was also the trade representative. And so once we understand that the synthetic biology, the neurotechnology, doesn't really have as much to do with healing people and making people's lives better as to create new markets, to open up new markets where our bodies then become colonized with technology. And that's an economic impetus, and that's something, you know, China has been doing very deep research into AI and artificial brains and neural nets, and Singapore is clearly one of those countries focused on bio-nanoelectronics and smart cities and electronic government. And, you know, Russia has its own stuff going on. You know, the one individual that I have kept track of in the education space, Pavel Luksha, is a transhumanist. And, you know, during the Cold War era, Russia was doing a lot of work around psychiatry and how the mind works and parapsychology and a number of different things around consciousness. And so, you know, we see all of these things coming together. It's interesting to me that Huntsman has direct ties to all three of these countries and has ties to the economics, and then is here in Utah where they're doing a lot of this technology work. Again, we're still in this office park that's affiliated with the University of Utah. So this expansion of the facility to have 170 new beds, but it's also going to include research and a wet lab that they discussed. So this is from a press release last year, and it says that Dr. Mark Rappaport, chair of the University of Utah Department of Psychiatry and CEO of the Huntsman Mental Health Institute, said the new MRI system will lead to new discoveries in the causes of mental health disorders. Quote, "We need a 7 Tesla magnet so we can actually begin to tease apart the brain circuits that are involved in predisposing people to substance abuse disorder or schizophrenia." And he said that will be a shared resource. And so it's interesting, it's important to understand, I mean, I acknowledge that mental health and substance and addiction issues cause tremendous harm to many individuals and many families and come at tremendous social cost. Those, navigating all of that, that is connected to social impact finance. The opioid crisis is very directly connected to social impact finance, as well as mental health. And so we can imagine a day where they start to use predictive profiling of your neurological status through wearable technologies to start profiling you of being at risk of a mental health disorder. And in this moment where all of society is being ripped apart with the fourth industrial revolution, with human plus, with human centaur existence, man machines, people being displaced out of their jobs, many people are going to have a hard time navigating what is it, the quote, you know, being sane in an insane world, right? How do you, that's kind of, you know, it's difficult. So there's going to be more and more people who are going to start to dissent from the changes that are happening. And it seems very clear that with all of the technology that's in place, the digital enclosures, the panopticon, that people who question the overall narrative will be deemed to have disorders, right? And then those disorders will become impact markets. So on top of this, before we leave, I also want to mention, again, this institution is connected to the University of Utah Psychiatry Department. That department has been the focus of quite a bit of litigation over the past decade. One of the programs was called the Autism and Developmental Disabilities Monitoring Network. That was out of the CDC. It came out of the Children's Health Act of 2000, and numbers of centers over the United States were supposed to track autism and developmental disabilities, and it's the largest tracking system of autism in the country. So that one of those institutions was here in Utah, and it was affiliated with the University of Utah Psychiatry Department. The other states were California, Arizona, Utah, Minnesota, Missouri, Tennessee, Georgia, Maryland, and New Jersey. And Dr. Judith Zimmerman was the principal investigator who was managing that project for Utah. And she noticed early on that there were inappropriate accessing of data files on accessing of the data that she had collected as part of this project. And as the responsible party, she was very concerned about who was accessing the data through the University of Utah system and to what end. And so she has filed a number of, she was a speech pathologist, and she was appointed in 2005 the head of this Utah Registry for Autism and Developmental Disabilities. So she was a whistleblower in this, and she tried to alert people in 2012, and then the following year her contract was not renewed, and so then she filed suit because she felt it was her responsibility to raise awareness that the data for these autism networks were being accessed inappropriately. So she has pursued legal courses. There have been a number of damages awarded to her, like a $200,000 award in 2019. There was another one last year. I understand that she still has some more suits filed underway, and so she could not speak to this further. But as we understand, data, as Eric Schmidt said, is the new oil, and mental health data is a means of social control and a means of profit-taking with impact investing. And then you start linking that in with neural electronics and monitoring systems. You can have something that is a very real concern, the concern of addiction, the concern of schizophrenia, or this concern of depression, or the concern of autism, that has really very real consequences, but there's not much of an economic imperative to actually solve the problems. And I think much of this is actually towards shifting humans towards this post-human existence in the metaverse.